Hi, my name is Glenn Minchala, and we're going to talk about a randomized controlled trial of Ebola virus disease therapeutics. First, we're going to talk about the definition. The title of the article, the randomized controlled trial of Ebola virus disease therapeutics. The Ebola, also known as Ebola virus disease, is a viral hemorrhagic fever of humans and other primates caused by the Ebola virus. It was originated from bats in Africa. The animals ate the infected fruits, and humans ate those animals. Then humans started infecting other humans, and again and again.
The Ebola virus is a highly aggressive virus that is transmitted through bodily contact with an infected, symptomatic individual. The Ebola virus enters the body primarily through direct contact of mucous membranes, like the eyes, or through abrasions in the skin. When inside the body, the virus fuses with tissue cells, invades them, and releases its genetic content into the cell. This is similar to many viruses, wherein the viral RNA uses the host cells to generate copies of itself. The genetic material takes over the cell machinery to replicate itself. New copies of the virus are formed, released into the system, and dispersed. This also causes the cells to explode, sending infectious particles flying. Ebola then overpowers the immune system. The very cells that are meant to fight infection are used as carriers to spread infection to other body parts, including the liver, spleen, kidneys, and brain. The virus attacks almost every organ and tissue in the human body, resulting in an overwhelming inflammatory reaction. This is what causes sudden flu-like symptoms that are the first signs of Ebola.
Okay, we have the applications in medicine. The signs and symptoms typically start between 2 days and 3 weeks after contracting the virus. The virus is spread through direct contact with body fluids, such as blood for infected humans or other animals. The spread may also occur from contact with items recently contaminated with body fluids. The incubation period, that is the time interval for infection with the virus to onset of the symptoms, is from 2 to 21 days. The person infected with Ebola cannot spread the disease until they develop the symptoms. The symptoms of Ebola disease can be sudden and include fever, fatigue, muscle pain, headache, and sore throat. This is followed by vomiting, diarrhea, rash, and symptoms of impaired kidney and liver function. In some cases, both internal and external bleeding. For example, the oozing of the gums or blood in stools. Usually, the laboratory findings include a low white blood count and platelet counts and elevated liver enzymes. The diagnosis can be difficult to clinically distinguish between the Ebola disease from other infectious diseases such as malaria, the typhoid fever, and meningitis. The many symptoms of pregnancy and Ebola disease are also quite similar. Because of risk of the pregnancy, the pregnant woman should ideally be tested rapidly if Ebola is suspected. The confirmation of symptoms are caused by Ebola infection and are made using tools like ELISA test, the antigen capture detection test, the seroneutralization test, the RT-PCR, the electron microscopy, isolation of the virus by cell culture, and well, the investigational therapies are CVMAT, Redensivir, MAT 11.4, and Regin EV3.
In this emergency, I feel we've made some tremendous advancements in the clinical care of patients that are affected with Ebola. there are three kind of most notable changes or advancements or innovations. One is actually the site, the location where the patient is cared for. Currently, we are using innovative therapeutic unit designs that our partners have put into place, where you can deliver very patient-centered, individualized care. And that is different than prior outbreaks, where the majority of patients received care in large tents where there was not a lot of patient privacy or ability to do individualized supportive care. Supportive care. And what does that mean? That means we can give patients hydration through an intravenous access, which is also was not done routinely in past outbreaks. We can correct dehydration. We can correct electrolyte abnormalities. And the third, which gets the most attention, is the use of investigational therapeutics that are geared directly towards Ebola virus. All patients that have been admitted to a treatment unit have had access to an investigational therapeutic.
Okay, now we have the pros and the cons. The pros, the patients be assigning only to the MAP 1140 and region 83 groups for the remainder of the trial. This study showed superiority and lower mortality rates. The cons, we have the CMAP and remdesivir show higher mortality for Ebola virus disease. The issue apply in Ecuador. Currently, at this moment, the National Epidemiological Surveillance System of the Ministry of Public Health has not registered any suspected or confirmed Ebola cases in Ecuador. And we have the conclusion. The conclusion is that both MAP 11.4 and REGN-AB3 were superior to the treatment compared to CMAP in reducing mortality from Ebola disease. The Ebola virus disease has been developed and the safety and efficacy of the most promising therapies need to be assessed in the context of randomized controlled trial. Thanks.